Welcome to Section 1 of Chapter 2, Fee-for-Service Overview.
The first and most common methodology for payment is obviously fee-for-service. You're already used to this. It happens all the time. Do a service, they pay you a fee for it. The fee is negotiated in advance. That model is going to be around for a long time. There are some where they mix models together. So it's important to understand fee-for-service and how you interact with a health plan for fee-for-service. You bill codes, right? Each code has a relative value, and they're paying based on that relative value, either straight to the RBRVS or as a percentage of Medicare. As you add services, you want to be sure how to code for those services and that you're getting paid properly. Adding behavioral health might be part of the codes you use today, which have that fee-for-service reimbursement. Adding behavioral health services to your practice might entail having additional codes, and you're going to want to talk to the health plan about adding those codes to your charge master or your fee schedule so that you get paid for it. So every practice has what we call a bell curve. You do X number of whatever codes. So you do a lot of 99213s, you do a lot of 99214s for established patients, and then maybe 99203s and 99204s for new patients. Use your own data, just the information that comes out of your billing system, your accounts receivable system, that shows how many times you do certain things. The health plans may be interested in the diagnosis codes that you have within your population. They may also be interested in that bell curve analysis, that number of codes, the services you provide. Keep in mind, at the end of the day, the health plans are most interested in cost savings. The things you do in your office, those levels of service, even if they tend to be on the high side, if it overall cuts down their overall costs, they're very interested in that. But they want to see data to prove it. When you interact with the health plans, the commercial health plans, and you start to talk about rates, keep in mind you may actually want to do a little bit of cost accounting, real simple stuff. You want to include in the discussion your cost of doing business. Believe me, they'll listen to you if you have information. You might show, maybe you're in a rural area where the cost of labor is a little bit higher. It's hard to recruit providers. Those are the kinds of things you want to point out to a health plan to help them understand why you're asking for the rate that you might be asking for. You want to use your data to tell your story. So not only are you open maybe on weekends and evenings, you can show volume that comes through your practice, which saves the health plan money, but you also want to show that your patients are happy. You may survey your patients, find out how happy they are. Your patients, remember, are their customers. So in this fee-for-service environment, when you're negotiating with a health plan for, maybe better rates on this or that or the next thing or all things as a percentage increase, you want to, tell your story. Use even basic information from your practice like volume, hours that you're available, the numbers of patients you see. All of those kinds of things are important, and they show the health plan that you know what you're doing and that you're really taking care of their members. Fee-for-service is all about kind of what you do best. That, again, keeping in mind that bell curve. The things we do the most, those are the codes, those are the fee-for-service reimbursement that you want to really pay attention to. It's not that important for the things you don't do very much of, right? You want to go to the health plan, understand where your bell curve is, what are all those things you do the most and do the best, and like to do, frankly, and concentrate on those when you sit down and talk about rates. Remember this mantra. Fee-for-service is about do what you do best. Do the things that you like to do and the things that you do the most of. You want to use your data, even claims data, aggregating what it is you do, why you do it, all of those sorts of things that tell that story about how you're the best at what you do.